It started when he was 8 weeks old, and I noticed his eyes were yellow, and so we took him to the pediatrician, and the doctor in his exam was feeling and said, you know, I can feel his liver, it's big. They came back saying he had biliary atresia.
Biliary atresia is a problem with the bile ducts. Commonly it occurs after birth. They present with jaundice and often pale stools, which is an indication that the bile that normally flows into the intestines is not flowing normally.
And so they did an operation, and that was not successful.
About a third of the children that have this need a corrective surgery early on in life. And even with that corrective surgery, a large percentage, most of those kids ultimately go on to transplant.
He was transferred to Children's Memorial Hermann Hospital, where he was evaluated for a transplant, and he was listed. And then he spent about a month waiting. He was 4 months old. Many doctors came and explained everything and the process, and the transplant coordinators came and talked to me. That morning, a whole entourage of doctors came in bigger than normal during rounds, and they just said, we have a match. It was a big relief to know that we could stop waiting and stop looking at him get sicker and sicker.
Nicholas has done really well. Of course, we used to see him every month to every few months now. We only see him every 6 months. He's growing like a normal kid. He looks really great. Everything's been working great, so we're really hopeful that he can just continue on to a normal life like any other kid.
When you kind of plot him on the growth curve, he's above average for his weight, for his age. We're very happy with how he's doing.
He's doing great. He knows how to swim, and he does gymnastics, he plays soccer, and plays with his sister, and does all things boys should.